You know, the human nose is a pretty amazing thing. But let's be honest, it's also a very tempting target for small objects, especially if you're a little kid. So today, we're going to dive into what happens when that innocent curiosity leads to something getting, well, stuck. And as you're about to see, the consequences can be way more surprising than you might think.
Okay, picture this. It's a scene that's super familiar to any parent. A kid's got a runny nose, but it's only coming from one side. Your first thought is just a cold. But what if it's something else completely? What if the real culprit isn't some virus, but a piece of a toy, or maybe even a pea from lunch?
Now, before anyone starts to panic, let's get one thing straight. The vast majority of these cases are not serious at all. It usually happens with kids between the ages of 1 and 8. And you might be asking, why that specific age range? Well, think about it. Kids get the fine motor skills to pick up tiny things around 9 months old. And with that awesome new power comes experimentation, and their noses are often ground zero for those experiments.
So what exactly are these little explorers putting up there? That brings us to our first section. Let's meet the usual suspects.
And yep, the list is pretty much what you'd guess. Food items like peas, beans, and nuts are total classics. But so are beads, little wads of tissue paper, tiny toy parts, and even rocks. I mean, it's really a testament to a child's creativity, you know? If it's small enough to fit, it's a candidate.
Okay, listen up, because this is crucial. If you only remember one thing from this part of our explainer, make it this. That word, pathognomonic, it's a fancy medical term, but it just means a symptom is so specific it points to one single diagnosis. So if a kid has a foul-smelling discharge coming from just one nostril, it's almost guaranteed there's a foreign object in there. That's the telltale sign. All right, so a bead or a pea that just got stuck is one thing. But what if it isn't discovered? What happens if an object stays hidden deep inside that nasal cavity, not for a few days or weeks, but for years, maybe even decades? Well, that's when things start to get a lot more complicated.
And that leads us right into our next section, where we're going to see how a simple forgotten object can literally transform into a serious solid obstruction. So the body has this really strange and fascinating reaction to something that's been stuck inside it for a long time. It starts to encase it, layer by layer, in calcium and magnesium salts. It basically turns it into a stone. And this has a name. It's called a rhinolith. That literally means nose stone. That tiny little bead or that seed becomes the core, the nucleus, for this big, gnarly, calcified mass. And this table right here just illustrates that transformation perfectly. Look at the column for a simple foreign body. You've got a little kid, it just happened. Now look over at the rhinolith column. The patient isn't a child anymore. They're an adult who probably has zero memory of how this all started. The timeline has jumped from recent to years. And the effects? They've gone from just simple irritation to pressure necrosis, which is when the tissue around it starts to die, and ulceration. It's a whole different ballgame.
I mean, a calcified mass literally growing inside your head, destroying tissue as it gets bigger. That sounds about as bad as it gets, right? It's really hard to imagine something worse than that. But there is one final, and frankly, far more alarming, category of nasal foreign body that we have to talk about.
So, this brings us to our final and definitely most intense section. What happens when the foreign body isn't a piece of plastic or a bean, but something that's actually alive? The condition is called nasal myiasis, and it happens when a fly lays its eggs inside the nasal cavity. Those eggs then hatch into larvae, or maggots. This tends to happen to people who have pre-existing conditions that have damaged their nasal lining, like atrophic rhinitis, so they might not even feel the fly in the first place.
And what is truly terrifying is the speed of this progression. I mean, look at this timeline. Within just 3 to 4 days, the person is feeling intense irritation, they're sneezing constantly, they have headaches. Soon after that, you can actually see maggots crawling from the nose. And in the advanced stage, those larvae begin actively destroying all the surrounding tissue.
The potential consequences here are just devastating. We are talking about the destruction of the nose itself, the sinuses, the soft tissues of the face, even the eyeball. In the absolute worst cases, this can lead to meningitis and, tragically, even death. This is a true, life-threatening medical emergency.
Okay, so after covering all of those escalating and pretty scary scenarios, let's switch gears and talk about the solutions. How do doctors actually fix these very different problems? That brings us to our final section, the path to healing.
And this table lays it all out really clearly. For a simple foreign body in a kid, you can often just remove it right there in the doctor's office with some forceps. For rhinolith, because it's so big and embedded in the tissue, that requires surgery. And for nasal myiasis, the first step is actually to kill or anesthetize the larvae so they let go, and then they can be removed one by one, followed by a really thorough cleaning.
And here is a fascinating final detail that you probably wouldn't expect. Patients who are being treated for nasal myiasis are often isolated under mosquito nets. Now, why would they do that? Well, it's actually a really important public health measure. It's to prevent any flies that might hatch from the larva from getting out, maturing, and then laying eggs in other people or spreading other diseases.